Welcome to the Menopause Stories podcast. I'm your host, Dr. Tamara Beckford, founder and medical director of Truly Balanced Wellness Care. This is the space where we stop the guesswork and start the optimization. We're pulling back the curtain on that midlife hijack and giving high-achieving women the clinical roadmaps and unfiltered stories they need to reclaim their edge. Let's get into today's story. Hey, welcome back to Menopause Stories. I'm so glad that you're here. If you're new, welcome. You have found the right place. Today, we're diving into one of the most frequently asked questions I get. And honestly, it's one of the most kind of frustrating ones too, because it really should not be this hard. But for so many of us, it actually is. The question is, how do I actually get HRT or MHT, and how do I find a doctor who listens to me? Now, you can understand why that shouldn't be that hard, because in med school, listening is kind of like the first part of what we learn about being a doctor, right? But maybe so many of you have already felt or have been dismissed. Maybe you sat in that office and you described your symptoms and you walked out with nothing but a pamphlet on lifestyle changes. Or maybe you've been told you're too young to be going through this, or your labs are normal, or you just need to manage your stress. And you're sitting there thinking, is this me? Am I asking for too much? No, you are not asking for too much. You deserve care. And today, I'm going to walk you through exactly how to get it. Now, we're going to start off with HRT versus MHT. Let's clear this up. What is this? What's HRT? What's MHT? Before we talk about how to get it, let's talk about what it even is. Because the terminology alone can be so confusing. All right, you'll hear HRT and you'll hear MHT. So HRT is hormone replacement therapy, and MHT is menopausal hormone therapy. So they're referring to the exact same thing, but MHT is actually the newer preferred term because it's a little bit more accurate. I know, it's in the details. So we're not just replacing hormones. We're supporting the body through a significant hormonal transition. So what's in it? Most MHT involves estrogen, which is the primary hormone that drops during menopause. So if you still have a uterus, you'll also still need progesterone to protect the uterine lining. And guess what? There's also testosterone in there, which is often the missing piece that nobody talks about. It affects energy, it affects libido, it affects mood and brain clarity. But a lot of times we're not hearing about testosterone, especially for women, right? So it comes in many forms. This MHT, you have patches, you have gels, you have sprays, you have pills, you have creams, you have vaginal rings, you have implants. So when we all think about it in its entirety, it's not really a one size fit all, which, is kind of good news, because it means that there's likely a version that might work for you, work for your body, and for your life and lifestyle, right? The key thing I want you to walk away with here is that MHT is not just about hot flashes. It can help with sleep, brain fog, joint pain, mood, vaginal health, heart health, and bone density. So when we're hearing about menopausal hormonal therapy, it's about the whole body care. It's not just about reducing hot flashes, right? Now, what's our next thing? How to find a menopause literate doctor. Here's the honest truth. Not all docs are created equal when it comes to menopause. And that's the truth. This isn't about blaming your doctor. It's really a systemic issue, and it really boils down to the education that us doctors are afforded about menopause during our training. Menopause medicine has not really been funded, and so it's really been underrepresented in medical training. Many physicians, including me, during medical school barely got any menopausal education. Some as little as like 2 hours or so for the entire medical school. And I mean, that's like 4 years of hours and hours, and maybe just 2 hours dedicated towards menopausal care. So if you think about this, you might need to use a little bit of strategy to find that person, and that's okay. So you're not really being difficult, you're really being your own advocate. And I think that most docs respect that. Where do you look? So there are places where you can find doctors who have done additional training, and there are some that are listed online. There are some that are listed in societies, such as Menopausal Society. They have like a directory. You can look at other doctors who have got additional training through other sites, like I did. I got additional training through Rachel Rubin, who taught, in addition to reading Menopause Society and the handbooks and all the guidelines on how to treat women who are going through menopause. There are also practitioners who have trained in other countries, right? So those who are in the UK, they have the British Menopause Society. You also have, they also have a directory that you can look online. Now, beyond looking at directories, you can look for some OBGYNs. But as we just mentioned, and some of your OBGYNs will be completely honest with you too, they didn't get a lot of training in menopausal care also, which was pretty surprising, especially recognizing that for women, there is a huge portion of our lives that's postmenopausal. And so to really not get a lot of care and training in menopausal care really, really was a disservice to some of our OBGYNs. Now, some OBGYNs have taken the initiative to get additional training, and then some have opted that, it's okay, I will send my patients to doctors who have opted to get additional training, and that's no big deal for them because they would love for their patients to be able to get that extra time that they in a busy OBGYN practice might not be able to afford their patients, right? So they'll send their patient to someone like me who's done the extra training, who has the time to take care of our patients who are going through menopausal or perimenopausal state of life. So there are also some functional medicine doctors, there are integrative medicine practitioners, and there are also some nurse practitioners who have gone out and gotten additional training, physician assistants. These are people who have dedicated additional training beyond just the scope of what they have been taught in their specialty. You've done additional hours, looked at the material, and have dedicated the hours to providing the care for our women. And they, like we said, usually for those of us in this type of specialty who have dedicated the extra time, we have decided that not only do we want to help our women, but we want to provide more time to sit and be able to do a whole body care for you. And within traditional medicine, unfortunately, most of the time that doesn't work, right? So there's also an increase in other options such as telehealth, which is what I provide with Truly Balanced Wellness Care, where we provide the care through telehealth so that you can be able to get this access care during times that are convenient for you. There are other platforms out there that also do the same thing, and they specialize in menopausal care. And of course, that helps a lot, right? Because some of you might not have the access for the time. You might need it during the middle of the day when you are on your lunch break, and you might not be able to drive over to the doctor's office. You might not be able to take that time. Or what about ladies who are in rural areas that their menopausal doctor is 2 hours away in order to get the appointment, or, you have to take a whole day off. Maybe you don't have that access. But providing the health through telehealth, it helps to bring this care to some additional subset of society for our women. So we have telehealth, other telehealth providers are like MediHealth and Genevieve. They do the same thing. So now here we are, right? Signs that you have found a good menopausal care doctor. So a menopause literate provider will ask you about symptoms in detail. So it's not just about your blood work, because they want to understand that, even though your labs may be misleading during perimenopause because your hormones are fluctuating. It's up and down, up and down. You might have drawn your blood work during a time when the labs will come out, quote unquote, normal. But the week after, your blood work, if it were drawn like even 1 week later, it will come out in the abnormal range. And you're probably listening and trying to figure out, like, how does that work, Dr. Beckford? Like, if my blood work was drawn and it says it was normal, like, how will it be abnormal the week after? Well, when we think about it, especially during perimenopausal portion of life, our hormones are going up and down, which attests to some of the fluctuating moods and symptoms that we feel. So if your blood work is drawn during a time where it falls within the quote unquote normal range, your lab results might look normal, but it doesn't necessarily correlate with how you are feeling, right? And that's why a doctor is going to look at you as a whole person and not just the blood work. So you won't be dismissed based on your blood work is normal. Another sign that you also have a great provider is that you won't be dismissed based on your age, because they'll talk to you about options, not just hand you a prescription and say, toodaloo, on your way. No, they'll really sit and discuss. For me, it's the biological, the psychological, and the social aspect, right? So there's so much going on during that time. Now, what is it that you will say when you get to that appointment? So now you've gotten, you've done your research, you figured out that you wanted to get care during this portion of your life, and now you're at this appointment. What is it that you're going to do? Number one, make sure that you enter your appointment prepared. Now, what does that mean? Walk in with a list of symptoms. Even if you're not sure if it correlates, because there's so many things that's happening in your body at that time, you might not even know if this correlates to perimenopause or menopause. Like, for example, misophonia. And you're probably like, what is that? Now, when people start chewing, you hear about women who are just like, oh, their husband snoring gets on their nerves. Their husband breathing gets on their nerves. The way that they chew gets on their nerves. Now, you've been with this person for so many years and it didn't bother you, but then it's starting to bother you. And you might write that down on the list and think that, I don't know if it's really, does this fall into that category? Yeah. Yes, it does. It does go along with the list of perimenopausal, menopausal symptoms, because you start to get this heightened sense of awareness. You become a little bit hyper-focused on things that are around you. And it's not something that's talked about often. So if you are not writing down these lists of things, you might figure, well, if I'm not having hot flashes, maybe I don't fit in that category. I'm not really able to focus. But then you might say, well, you find a reason as to why you're no longer focusing that much. Well, it has been more stressful at work. I did change jobs. I am having a hard time with ABC, and it must be related to this. It doesn't matter. Just write it down. Write down the list of symptoms of how you're feeling and how it's affecting you. I know it might sound basic, but just write it down. Write it all down. So it's not just about hot flashes. It's not just about sleep. It could be about like joint pain, anxiety. If you have been a person who has been able to handle all of these things, you're able to juggle life, such as your career, your family, your personal life, and then all of a sudden you're starting to feel anxious and you're noticing anxiety is taking over. It's not you. You have not gone crazy. Write that down. If you're starting to notice that you can't concentrate, or you're starting to feel depressed, and you're like, I'm not a person that usually feels depressed, write it down. You're noticing joint pain, write it down. Your cycle starts to change, write it down. Mood shifts, write it down. Low libido, write it down. Vaginal dryness, write it down. Heart palpitation is waking you up in the middle of the night, write it down. All of it is important. And your doctor will be able to respond to these specifics. Now, also not only write down what's happening, but start documenting or write down like how long you've been experiencing it and how often it's happening. And especially, most importantly, how is it affecting your daily life, right? So I can't sleep more than 3 hours because I'm waking up and I'm drenched. That related to hot flash, right? Or I'm waking up 2 to 3 times a night with my heart racing. As a matter of fact, I ended up going to the ER because I thought I was having a heart attack. Write it down, right? I'm not sleeping well. Write it down. I'm noticing that when I'm at work, I'm starting to feel anxious when people ask me questions. And these are questions of things that I know. Write it down. We want to know everything. We want to know everything. Here are some phrases also that can help to open the door if you're unsure or uncertain on how to approach this topic with your doctor. You can try saying, I'd like to discuss whether hormone therapy might be appropriate for me. That's it. I'd like to discuss. That's it. I'd like to discuss. And then you just open that door. So this signals that you've done your research, you're ready to participate in the conversation, and you're not just really being a passive patient. And also it signals to the doctor that you have recognized that there's something going on and that you are ready for a change. Now, this is not to say that if you don't bring it up that way, that you're not ready for a change, because I've talked to a lot of females, and a lot of us during this phase of our life that we don't know how to bring it up to the doctor. The doctor, and on our part as physicians, as providers, it's up to us we also have to open up the doors to our patients, because we are taught to say, is there anything else that you'd like to discuss? And a patient might say, no. So we need to also open the door. But since this is about advocating for yourself, ladies, I would love for you to be able to advocate by saying, I would like to discuss, or you might say something like this. I've read the current guidelines supporting MHT for women in perimenopause and early menopause without contraindications. I'd like to talk about my risk profile with you. You might not be able to remember all this. That's another way to say this. I kind of looked up all the things about menopausal hormone and support, especially, women in my age range who are more than likely either perimenopause or early menopause. And I'd like to discuss my risk factors. I'm thinking this might be something I want to try. Yeah, because remember, each one of us, we're all individuals, and so your care will be personalized. So you wanted to discuss your risk factor profile means that, okay, you are looking for care that's dedicated to you. So what are some things that you can also ask? What would need to be true for you to recommend hormone therapy for me? You might be like, just cut straight to the chase. Like, all righty, listen. Hot flashes, mood swings, everyone's getting on my nerves, and my joint ache, and I've gained all this weight. I'd love to discuss hormone therapy. Okay, that's not an unreasonable request, right? That's not an unreasonable request. But it's also important for you to ask questions going to make you feel comfortable. You can ask about bioidentical versus body identical. You can talk about micronized progesterone versus the transdermal estrogen. Which one have a favorable safety profile? What are some of the side effects? What about testosterone? Is this something I should explore? Is this something I shouldn't explore? If I'm on testosterone, what should I be looking out for? You can really dive really deep into all of this. And when you have a menopausal care or menopause provider, someone who's deeply involved in this, these aren't questions that are offensive at all. These are questions that really, really look deep into the patient and be able to give them a sense of comfort once they get that understanding, right? So once you get that response, you get that deeper level of understanding, then you as a patient feel comfortable saying, okay, yeah, I'm ready to start this. Okay? So what would you do if you're dismissed? And this is a great segment portion too, because I'm reading online. There's so many of you women, are feeling dismissed or are being dismissed. So I'm not going to just say you're feeling dismissed, because we all know what it is to feel, and we also know what it is to gaslight ourselves to say, well, maybe I'm feeling this way, but that's not what they meant. No. There's a reason why we have that sixth sense, right? So you are being dismissed. So first, know that it's not you. If you leave your appointment unheard or feeling unheard, I want you to know that this is not a reflection of you, it's a reflection of the system. Your symptoms, what you're feeling, this sense of anxiety, instability in mood, inability to really make concrete decisions when that not only were you able to do that before, but that's just not part of who you know you are. These are real and you will need legitimate care. So you do have the right to seek care elsewhere until you find someone who you feel is providing that care, who's listening and providing that support that you need. So in the moment, if a doctor dismisses you, try saying, I understand your perspective. I'd like to understand the specific reason you don't think I'm a candidate for MHT. And then let them articulate it. Sometimes that question alone can shift the conversation. So if you ask that specific question and then you get an answer that satisfies you, like, the risk factors, then okay, it's now up to you to decide. But remember, this is a conversation that you're having, and your care, it's a dual street. You're being cared for with your doctor or your provider, not just by them, but you guys are making the decisions together. So we said if that person does not feel comfortable, you can ask, will you be willing to refer me to a specialist in menopausal care or menopausal medicine? Or can we revisit this in my next visit if my symptoms continue? All very valid things. All very valid. Now, if it keeps happening, of course, get another opinion. And it's not rude for you to look for another doctor or someone who is specializing in that particular portion of your care. Any good doctor will understand. And we'll also put the caveat that not every single doctor, even if it's your primary care doctor, wants to delve into menopausal care. And it's not that they don't like you, it's just that it requires a little bit more time, and sometimes they're not afforded that time in their schedule. So if you ask, is it okay if you can refer me to someone else? Most won't get offended. Most will not get offended. You're allowed to walk out there feeling like you're being served. And you should feel like with leaving all of your appointments with any one of your doctors, you should feel heard, you should feel like valid, and you should feel that you have gotten an explanation of what's going on in your body and an expectation as to what the next steps are. So make sure you write things down, keep a record of, what was prescribed, what wasn't, why. Make sure you're leaving with an understanding of what's going on so that you can bring that particular information. It's not only important for you, but it's also important for the next doc. Because if your provider says your risk factor profile puts you at risk for ABC, and that's the reason why this is not being prescribed, when you go to the next doctor, you need to provide that information too for them to either validate it or to be able to say, I understand, but that used to be the old way of thinking. New data has come out to show that that's no longer valid, and this is why. So important, right? So you can find menopausal support online, you can find it in communities, you can find it in other women who've navigated the system on this wonderful podcast. I have women who I've interviewed who've gone through this and are willing to tell their stories. So you can really, really find that community so you can go to them and you can listen. And not everybody you need to know on a personal level. Sometimes we learn from just listening to others' stories and to others' point of view, and to be able to get that info to know that, okay, I'm not the only one going through this, and I'm not a silo. And that's what I aim to provide here on the Menopause Story podcast. So, okay, before I let you go, I want to say this. You do not have to figure this out alone. That's exactly why I do what I do. So if you've been struggling to navigate your options, you're not sure where to start, or if you just want to walk through what's going on with someone who gets it, I'd love to connect with you. I offer complimentary consultations, and you can book yours at trulybalancedwc.com. We'll walk you through your symptoms, your history, and what care might look like for you. No pressure, just a real conversation. That link is in the show notes, so go book your spot because you deserve to feel supported. No, that's a wrap for today's episode of Menopause Stories, but if this resonated with you, please share it with someone who needs to hear it. A friend, a sister, a colleague who's been struggling and doesn't know where to turn. Sometimes the greatest gift we can give each other is the right information at the right time. Leave a review if you haven't done so already. It really does help more women find this show. And I will see you in the next episode. Take care of yourself. Why? Because you're worth it. This episode is brought to you by Truly Balanced Wellness Care. Most high-level women are told that their labs are normal while they're struggling to lead through brain fog and fatigue. At Truly Balanced, we don't settle for not sick. We architect for peak performance. Whether you need a 30-minute hormone strategy session to audit your labs or are ready for our 3-month Jumpstart Intensive, we provide the physician-led roadmap to get you back to your best. Visit the link in the show notes or go to www.trulybalancedwc.com to secure your spot. Now, back to the conversation. You've been listening to the Menopause Stories podcast. If today's conversation hit home, don't let your story stay stuck in that midlife hijack. Head over to the show notes to book your strategy session and to join the movement of women redefining their power. I'm Dr. Tamara Beckford. Stay optimized, stay bold, and I'll catch you on the next episode.